Hello, I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the Cure Center for Chronic Disease in Springfield, Illinois. You can find more information at www.thecurecenter.life, thecurecenter.life. And I'd urge you all to take advantage of our um, very informative website and all the educational material that is there. I want to talk today a little bit about why we are really not a prevention program, but an early intervention program. Now, in a sense, by reversing arterial disease and type 2 diabetes with our protocols, yes, we are preventing heart attacks and strokes, but we are actually intervening early in a much more chronic underlying disease process. Long before one suffers a heart attack or a stroke, and by the way, everybody feels perfectly fine, 5 minutes before they suffer one of these events. So you can't go by how you feel at all to know whether you're at risk. You have to look for the underlying disease and then just deal with it and address it. But the key thing is that we aren't preventing this from happening. We need to start to prevent this condition from happening. We need to start in childhood with eating habits and exercise habits and other lifestyle related issues and looking at genetic risk. So we're really way down the road by the time we find this condition. The most likely situation is that we find the condition at the point where we see atherosclerotic plaque, or at least some inflammation thickening in the artery wall. And what we are all about, and one of the reasons I wear a scrub top as my uniform, is that in a way I am an interventionalist. I'm not doing stents or surgery, but we're doing lifestyle, supplement, and pharmacologic intervention on a systemic process and creating reversal of this disease, much like you would take early detection of a cancer, let's say a precancerous polyp in the colon or a skin cancer that you detect early. If you deal with it early, your chances of survival and a good outcome are much better. So a little bit of arterial disease should be dealt with like a little bit of cancer. And although we didn't prevent it from happening, our early intervention can prevent its consequences. So, in fact, we do have ample evidence of reversal of this disease process, much like you would put cancer into remission and keep it in remission, which is, in essence, one definition, a way that we refer to as a cure. Do we ever actually see the disease disappear? No, that's not what this is about. But we do see the consequences disappearing. In fact, in the last 10 years, over 1,000 patients. I've had 0 patients suffer a stroke or a heart attack. And that's a record that I'm very proud of. Never would have expected it to be that good. But over the years, we've learned as many of the tricks in the trade as anybody to address root causes and see this condition go in the direction away from a life-altering or ending event. For more information, I urge you to go to thecurecenter.life and register for a discovery call at thecurecenter.life/discovery-call. And we can talk more about how we can help you identify and reverse previously unsuspected arterial disease and prevent a heart attack, stroke, or dementia. Thank you.